My name is Samantha Arrington. I'm currently enrolled in CAMC's anesthesia program, and my current title is student nurse anesthetist. Currently, for the anesthesia program, nurse anesthetist, you're looking at a 4-year RN degree with most schools. Currently, CAMC has a 2+2. You can have a 2-year RN degree, but you do have to have a 4-year degree to meet the requirements to get in. You have to have at least a year to 2 years critical care experience. A minimum standard on the GRE, they set, I think, at 950, and a lot of science background. I chose my job very early on. I was probably 14 when I decided to go into nursing, and that's what I wanted to do as a career path. My father was sick. I had interactions with the nursing staff at that point in time. And believe it or not, by high school, I always knew I wanted to go into nursing anesthesia. I felt like that was probably would be one of the biggest challenges and hurdles, and I'm almost there. But overall, I chose nursing because I feel like that is where I would be the best fit. I enjoy taking care of patients, I enjoy communicating with the patients. Whether it's healthcare, business, or so forth, that especially for healthcare, that you have the compassion, the kindness, and absolutely I think your heart has to be in it. I say that because I've seen individuals choose a career path because it's either what their family wanted them to do, they do it for job security, versus truly picking a job that's right for them. How many people can truly say, I saved a life today? It's a wonderful feeling to see patients come in, especially young patients, for any age, but some of the teenagers may choose and make mistakes. They're brought into the unit, very critical, and then their outcome is a positive one. It's a great feeling. I think this program is very intense. Some of the challenges that I've come across, even with my many years experience in critical care, it's still the learning is still ongoing. The things that I thought I knew, I didn't know, and those have been some big hurdles for me. A typical day starts very early. I'm usually at the clinical area at 6 o'clock. I go back, set up the room, make sure the anesthesia machine's working properly. Depending on the type of case that I have everything in the room that's required. Then I'll go out to the pre-op holding area, interview the patient, do past medical, past surgical history. Are there any implications to the type of surgery that the patient's having? And not only that, any type of meds or interactions that the team needs to be aware of. Currently, it's student nurse anesthetist. You'll be with a certified registered nurse anesthetist, and one of the anesthesiologists is part of that team. Post-op as a SRNA, I currently, once we finish the procedure, talk to the patient briefly in the recovery room. 24 hours later, we'll do another follow-up, see how the patient's doing, did the patient have any reactions to the anesthesia, and also if they're still in the hospital, then we'll also do another follow-up in 72 hours. I've seen many young children and teenagers during the course of working in the critical care department. They come in as traumas, they have traumatic brain injuries, some are left on life support in vegetative state, and I think that you really need to be aware as you're in high school and going through many changes, thinking about what your career path's going to be, that split second can change instantly, and it has so for many patients that I've taken care of. There's a lot of peer pressure, and so sometimes you just have to say no.